Hmm.
आया?
हाँ आ गया। देखते हैं लाइव क्या बनने है। आप अपना स्लाइड शुरू करो, स्लाइड शेयर। Slide presentation. Why you click on it? Nobody. morning, everyone. Today, my parasitology posting presentation. I am Dr. Jaya Vishwas. Uh, I have given this question. A 35-year-old male presented with symptoms of headache, recurrent cough, fatigue, and weight loss about 10 weeks after returning from his trip to different parts of India. His blood and sputum examination did not reveal any pathogens. A stool examination viewed under light microscopy for routine ova and parasite examination revealed a finding that measured 88 to 99, 88 to 92 micrometer into 47 to 48 micrometers egg. Please identify the pathogens to proceed to present your final clinical diagnosis of this patient.
Yes. Next, how did you approach your diagnosis?
Firstly, I will like to ask some history, like clinical history, any travel history, and patient is having any activities like swimming and any food habits like eating raw fish and uncooked crustacean or water plants, any like drinking habits.
Did you know which place he visit?
Ma'am, he different parts of the India he visited, but this question didn't mention which part of the India. So I'll be looking for any endemic disease is present in Indian scenario. So there are many parasitic diseases which caused by foodborne diseases from some specific area, like some foodborne diseases like when patient is infected with trophozoite of E. histolytica, when patient is or maybe patient is infected with eggs like Ascaris lumbricoides after eating some raw or uncooked pork or beef, like he will be infected with Tinea saginata, Tinea solium, or it can the patient can be infected with some lung fluke, liver fluke, or intestinal flukes, which can be caused by after intake of water plants or raw fish or crustacean and seafood.
So next slide. So with this history, what would be your differential diagnosis?
So patient is having recurrent cough, fatigue, and weight loss. So patient is basically having respiratory symptoms. So patient with these respiratory symptoms, I am suspecting some infectious causes or some non-infectious causes. In infectious causes, that can be bacterial, viral, fungal, or parasitic causes. In bacterial causes, it seems a patient can be infected with pulmonary TB, which is caused by Mycobacterium tuberculosis. Other bacteria which can cause pneumonia or atypical pneumonias like Streptococcus pneumoniae, Mycoplasma, Chlamydia, and Legionella. Some other viral causes, respiratory syncytial virus, influenza, parainfluenza 1, 2, 3, rhinoviruses, adenoviruses, and paramyxoviruses. Some fungus also can cause respiratory features like Aspergillus fumigatus, Histoplasma, Pneumocystis cerevisiae, and other like Coccidiomycosis immitis, Blastomycosis dermatitis, or Sporothrix chancri, or parasitic causes which can be primary or which can be secondary also. In primary causes,
what do you mean by secondary parasitic cause?
In which the organism is directly not penetrating the lung.
Okay.
Which can mainly infecting some other, mainly habitating some other organs of the body, but not penetrating directly the lung. So for primary causes, Paragonimus and visceral larva migrans, which are directly penetrating the lung. Some other secondary causes like which are causing pulmonary eosinophilia or Lafleur syndrome because of Ascaris lumbricoides, hookworm, and schistosomiasis. Some other organisms which are causing inflammation due to their infection like filaria and dirophilaria, and some are causing cystic lesions to the lung, echinococcus, and cysticercosis.
How does this nematode reach lung?
Nematode Ascaris lumbricoides. Firstly, human is ingesting egg. Human is ingesting egg of the Ascaris lumbricoides, which egg is then goes to small intestine, and it hatches there, and formation of larva, and it hatches there, and this larva goes to um, peritoneum, and then it penetrates intestinal wall and goes to peritoneum, and then it goes to lung.
It's keep
Parenchyma.
wandering and then it reaches to the organ which has higher intensity of oxygen. Okay.
Yes, yes, ma'am.
And then it produces pulmonary.
Pulmonary
Symptoms.
eosinophilia.
Okay. Okay. You have your viral causes also here
Yes.
and bacterial causes also, but among all this etiology, which can cause chronic
Ma'am,
illness?
generally, viruses are causing acute infection, acute cough, which is mainly resolved by 2 weeks, 2 to 3 weeks. But in bacterial causes, here atypical pneumonia, I have shown these causes: mycoplasma, chlamydia, and legionella. These can be causing more chronic cough, more than 8 weeks. So viruses are mainly, I am excluding that because of the patient is having cough more than 10 weeks.
Okay. So now your DD is narrowing down to
Bacterial causes, most probably Mycobacterium tuberculosis, and some parasitic causes, or maybe
do you think your second DD in bacteria like Streptococcus pneumoniae can give a 10-week history of pulmonary
No, ma'am.
symptoms?
It is also causing acute symptoms.
Yeah. Which species of chlamydia is known to cause pulmonary symptoms?